Dr. Craig Warden again, Medical Director for Clackamas Fire and Estacada Fire, and I'm here with Mike Verkest, the Training Officer for Clackamas Fire, and we're going to talk to you about push-dose epinephrine.
All right, let's get to it.
All right, so the background is, again, a lot of these protocol changes has come up through the trenches, and people have come up with problems and then develop solutions for the problems. So the problem we're having is we're trying to be aggressive in treating hypotension and shock, but it takes a while to get a norepinephrine drip up. So this is a way to get a quick pressor on board by using epinephrine.
And really, I think, and we'll probably talk about it a little bit, but this is really a bridge to get them on to norepi. Doesn't replace norepi. This doesn't, but like Dr. Warden said, it takes time to get the pump set up or the Buretrol or whatever it is. And these patients, you know, episodes of hypotension means that their organs aren't being perfused. And so we need to get something on board right away. So again, that's sort of the impetus of having this protocol.
Right, and so we'll have a demonstration on how to do this at the end, but it's really simple and it takes probably like a minute most to do it. So the other issue is sometimes you only need a brief administration of a pressor, so maybe only a couple minutes, and we'll go through the indications for that. And it's routinely used in the emergency department, the ICUs, and the ORs. And if any of you remember your paramedic rotations in the ORs, you know, you'd see the anesthesiologist and they would be carrying 6 or 7 syringes with them. Well, one of them was always a push-dose pressor because they can get into trouble when they're doing intubations in the OR in unstable patients. So again, the indications are, remember, we're trying to treat shock by using the mean arterial pressure, or MAP, and try to de-emphasize using the systolic blood pressure. So this is for severe shock when our MAP is less than 50 millimeters of mercury, and it's not responsive to fluids.
Yeah, I think that's a big key that we need to make sure people know is we're still going to try fluid, right?
Right.
So if their fluid's not seeming to do the trick, then we'll and we're heading down the norepi. That's exactly where the push dose epi comes in.
And so it can be a bridge to getting the norepi drip on board, or you can, again, use it for short-lived hypotension. Probably the most frequent thing that comes up again in the hospital is after intubation. And you know, you have a patient that is anxious, in severe respiratory distress, and you sedate them, paralyze them, and give positive pressure ventilation. A lot of times their blood pressure kind of plummets. So if you're going to intubate a sick medical patient, you should have push-dose epi available in order to have it ready to go in case they get hypotensive after you intubate them. Yeah. And it can also be used for sedation for a procedure. We're not going to see it as much if we're using etomidate for cardioversion, but if you end up using lots of Versed for sedation, either for a psychiatric patient, or other reasons to get Versed, they may need some brief push-dose epi. So again, this will be in the video, but just going quickly, you have your 10 ml normal saline flush, you waste 1 ml of that, then you draw up 1 ml of 1 to 10,000 epi, which is a total of 100 micrograms. You pull that into your 10 ml syringe, either using a 3-way stopcock or a double female adapter. Mix it up, and now you have 10 micrograms per ml in your syringe. Make sure you label it so no one mistakes it for your regular flush.
That would be
a big mistake.
Yeah, that would be bad.
And so the dosing is really simple. You give, for an adult, you give 1 ml every 1 to 5 minutes to keep their mean arterial pressure greater or equal to 65, or their systolic greater than equal to 90. It usually takes about a minute for the full onset, and it can last 5 to 10 minutes. So just, you know, give a cc, see what happens, give another cc. If you're giving it a couple times, then you should be getting the norepi drip going and get it headed to a hospital. For peds dosing, again, call online medical control to get the correct dosing for that. Mike Verkest and Dave Dennis will go over how to use the 3-way stopcock and a transfer valve to make up your push-dose epi.
Mike, do you want to go ahead and show them what you guys
Absolutely.
use over in Clackamas County?
Yeah, so basically, we have a new device that we're going to be using here at Clackamas, and you might actually start seeing it at some other places, but it's basically called a fluid transfer device. It's sort of like a three-way stopcock, but without the stopcock, if that makes any sense. So when we're talking about push dose epi, this is what we're going to do. We have our 10 mils of normal saline. I'm basically going to open it up, and I'm going to get rid of 1 ml. Okay, so just a little bit more. Okay, so we've gotten our 1 ml. We've got room here. And then we're going to take our epinephrine. We'll assemble this thing real quick. And basically how our fluid transfer device works is there are 2 caps. You just remove them. It basically looks like that. And it doesn't matter what side you put this on. One syringe goes onto one goes on the other. And you can either push or pull depending on how you want to do it. So for this, just to make it easy, I'm actually just going to put in 1 ml of the Epi 1 to 10. There we go. And now I have got my push dose Epi. A big thing that you want to remember, we're putting epinephrine in a flush, right? So we don't want someone to actually get this on accident. So make sure you use a medication label that says that this is not just a normal old saline flush anymore. Super important, because you could really hurt somebody if you do, somebody got this when they're not supposed to.
So Mike, then once you have that drawn up, you're going to end up with 10 micrograms per milliliter in your syringe.
Yep, and you're going to give 1 ml every 1 to 5 minutes, and then you'll be good to go.
Sounds good. All right, and so I'm going to show you then how to use the three-way stopcock if that's what your agency is using. So really a pretty similar process of what Mike just showed you. So I'm going to borrow the Epi 1 to 10 here. And so I'm going to take my 10 cc saline flush. I'm going to expel 1 cc out of there. And so now I have 9 cc's of saline in here. And then I'm going to take my 1 to 10 vial here. So my three-way stopcock, I just only need 2 of the ports here. So I'm going to take off 2 of the caps, hook up my saline here. I'm going to hook up my Epi over here. And then I'm going to make sure that my valve is turned to the opposition to the unused empty port there. And then I'm going to push in 1 cc of Epi 1 to 10 into my syringe. And now my syringe has 1 milliliter of Epi 1 to 10 and 9 milliliters of saline. I'm just going to kind of mix it up a little bit. Make sure I put my medication added sticker, just like Mike talked about. And that's what we have. So if you have any questions, please contact your EMS and or training officers at your agency. And thanks for watching. Take care. Thanks.